most of the discussion focuses on prevention and early detection, but we don't often hear much about the other side of the story, a woman's choice to have reconstructive surgery following a mastectomy. Here to talk about their very personal decision and to explain the options for reconstruction are board-certified plastic surgeon Dr. Alan Gabriel and breast cancer survivor Sherry Stowe. Welcome, guys, to Lowcountry Live. How are you today?
Thanks for having us.
Great. So I want to start with you, doctor, and ask you, how common is it for women to choose to have a mastectomy or a double one, and what are the typical reasons for having this type of surgery?
Well, most women with breast cancer will have some type of a procedure to remove their tumor. We've seen a tremendous increase in the number of double mastectomies over the last 10 years, and that's according to the Susan G. Komen Foundation. That's about 17% per year. The treatment of breast cancer is only part of the journey of the reconstructive efforts, the reconstructive options that every patient deserves to know is a very important process of the healing journey while the patient is undergoing breast cancer treatment.
Okay, so doctor, exactly what happens during the surgery and then the reconstruction, and how complicated is all of it?
During the mastectomy, the breast tissue is removed. Whether the patient is having it for preventative or for breast cancer reasons, reconstructive options are available, that's the time where we're rebuilding the breast. In the last 2 decades, we've had a tremendous increase in some exciting technologies, as well as enabled us to have improved techniques in breast reconstruction. And some of the two of the technologies that we use now is the allograft tissue matrix from Acelity, who we're partnering with today, as well as fat grafting, that gives us more options for breast reconstruction for our breast cancer patients.
Okay, now Sherry, I want to ask you a question. Tell us about your personal experience. What type of surgery and reconstruction did you have, and why?
I was diagnosed 3.5 years ago, and at that time I was given the option to have a bilateral mastectomy with reconstruction, which is what I did choose to do. And by having that reconstruction, I found that it emotionally really gave me the ability to move on with this breast cancer journey. It made me feel whole and normal again, so that breast cancer didn't rule my life every day.
That's great. And now that you've been through the surgery, what advice do you have for other women facing the same decision?
Oh, definitely to educate themselves on the process of breast reconstruction.
And for women that are interested in finding more information about their options, they can go to breastreconstructionmatters.com. There's great information in there that they can look online and educate themselves with.
All right, both of you, thank you so much. Such a pleasure to talk to you this morning on Lowcountry Live. And stay with us. We'll be back in just a moment.